All right. So I was going to go over today medical documentation. So going over, like we went over last week on questions you want to ask patients, how to kind of gather information from the patient so you can report it to the doctor. And then I wanted to go over how basically we document those things. Are you guys familiar with the SOAP note? Okay, perfect. So the doctor is the one that will put in all of that information, but part of the subjective is the information we gather from the patient, because it's subjective information, meaning like this is what the patient is telling us, what they're feeling. And then once they go into assessment, they'll put the diagnosis and stuff. So when we are gathering that information and putting it in the chief complaint area, the doctor usually basically just copies that information to put in the subjective. So, oh, no worries, Berenice. Um, all right. So anyways, let me go over to actually doing the, here, let me open up. Sorry, I just want to get into the chart here. Turn to previous session. Okay, so I also wanted to go around you do, of course, get the information from the patient, what brings them in for that visit that day, and try to gather as much information from them as possible. And like I said in the last one too, some people are not as forthcoming with information. So you might have to kind of dig a little bit because, I mean, I literally had someone come in and I've asked them what they've come in for that day and they said, my foot. Okay, which foot? My right one. What happened to your right foot? It hurts. So was there an injury that occurred? Like, yeah, sometimes you have people like that that you really have to like pull the information from. But we also want to go over as well their allergies, their medications. We also go over the last time they had a colonoscopy done or mammogram done or their labs done and stuff too. So because that way, we can keep up on the preventative care. I don't know about you guys just yet, but a lot of times you will have something done that you think just happened, 6 months ago or something, and then realize it was actually 2 years ago. So sometimes someone might not remember when their mammogram is due, and they expect us to kind of know that information. So we always go through that as well. So let's see. So this is this person's dashboard. And Tahila, I'm imagining are you familiar with like the chart part of this? I know you're familiar with like scheduling and certain areas of this, the billing and coding, but are you familiar with like the clinical care part of it at all in SimChart? Okay, perfect. So yeah, you know that this person, there's no data saved for any of these types of things. So like we can think of this almost like a new patient. So if we go to office visit, I'm going to just make one. And I'm going to say that this is a comprehensive visit with Dr. Alden, whatever. Okay. So here is all of the things that are going to be in the SOAP note. So we're going to go over allergies, their chief complaint. We actually go over most of this stuff here. So first, let's go over allergies. Let's say that this person is allergic to penicillin. So we're going to click on medication, and then we're going to type in penicillin. And it doesn't really matter like which one you select as long as it just says penicillin. And then we're going to put in there the reason, like what it is that happens when they take this medication. So if the patient is not sure, and sometimes this is something they were just told, they might have gotten it if they were a baby, we can put unknown because we don't know, what the reaction is. And also as far as severity, depending on like what information the patient does know, like say they're, oh, my mother told me I should never take it again, I would put severe. But if they're not sure, then you would of course put unknown. And then the informant would be, of course, either the patient or their parent, depending on their age. And you can put in here, you know, like if they're somewhat reliable, which is what we're going to put as it's somewhat reliable because they just said, you know, like, oh, my mother told me this. So you would put mother told patient of allergy. Okay, perfect. So now we're going to go in here and then we're going to type in their chief complaint. So we're just going to say this patient is here for foot pain. Okay, so patient presents for right foot pain after fall that happened 2 weeks ago. Has been trying with no success. Do you remember what RICE stands for? RICE. Do you remember what that stands for? RICE. RICE. No worries. Rest, ice, compression, and elevation. No worries. So that's what, like if the patient tells you pretty much that they've done that, you know, like they've been icing it, they've been keeping it up, you know, all of that, then we can put in here that they have been trying RICE with no success. Because of course we know what that means. So, so down here we could put if it's related to the injury, you know, you don't have to select all of these different things, but if a patient is having pain, we could try to find the part where it shows on pain here. So, okay, sorry. Then we go over their health history. So this, usually the patient will fill out beforehand, before they come into like the doctor's office. So basically, we can just go through this instead of having to ask the patient all of these different questions. This is something we can do outside of the room. So let's go to the next section. So I'm going to go over, and immunizations we could go through in here. Oops. Whatever. Okay. All right, preventative services. So let's go in here. So let's say this person is supposed to have laboratory testing every few months and a mammogram and such. So this is where you kind of go over and find that information. So we'll type in mammogram, and at the last one performed, let's select some time ago. So that way we can come in here, we're like, oh wow, this person hasn't had a mammogram in 5 years. So they're definitely due for that, which most of the time your doctor will let you just order that since it's been so long ago. So usually I would talk to the patient and just be like, hey, I see the last time you had a mammogram done was in 2015. Did you by chance have that done at a different office or someplace so we can get those records here? Because maybe they did go somewhere else. That is something that does kind of happen quite often, is they'll go to a different hospital and it doesn't automatically populate in the chart. So we would then fill out, you know, like a request of information to fax over to whatever place that they have that done at. But that is part of it, is we want to go over to make sure that they're not past due for any preventative medicines, even if they're just coming in for a follow-up on labs and it's not an annual visit. I mean, you do definitely want to go over all of these things in an annual visit, but it's not a bad idea to just go ahead and go over these things in a regular visit too, because some people, they only come in when they absolutely have to, so maybe once a year, and they don't realize that they're past due for these preventative things, or sometimes they're now at the age where they have to have certain things done, but they don't realize that they're at that age now. So we want to go over that kind of information with the patient. So, and problem list, that's what the doctor's going to put in. So that is basic. Problem list is basically like the diagnosis that the patient has in their charts. And then, of course, we would put vital signs in. So once we take their vital signs, we're going to put that information in as well. You know, like height, weight, temperature, pulse, respirations, all of that kind of stuff. You know, we're going to put that in to that section. So essentially, we're going to go over the chief complaint, their allergies, the health history, which you can do again outside of the room. They usually fill that out on a separate form. And that's usually done when they're a new patient and then when they come in for an annual. So that's not going to be at every single visit. You'll have to go through this whole health history. It's usually just the initial visit, and then there's a few questions from that on when they come in for an annual that they'll go over as well that you'll put in. But then we go over, besides chief complaint, allergies, and vital signs, the preventative services. So you'll get to know too, when you've been in the office for a bit, how often certain things are supposed to be done. So for example, some people, so if they're a female above the age of 25, they can have a pap smear every 3 years if the past have been normal. If they're under the age of 25, they need to come in and do it yearly. If a patient had one that was abnormal, it just kind of depends on if the doctor wants to have them come in 6 months or a year. But generally, if someone has had a abnormal pap smear, they come in yearly. Mammograms are done every 2 years, or if they've had, an abnormal one, again, maybe 6 months, maybe a year, they have them done that frequently. Colonoscopies are generally, if normal, every 10 years. If abnormal, depends on what they found, because it could be 5 years, it could be 3 years, it might be yearly. Just kind of depends on what they found. But in general, if something was normal, colonoscopies would be 10 years, mammograms would be 2 years, pap smears would be 3 years, if normal. But you'll get an idea of like those different kinds of things too, the longer you work in the office. I know it's kind of confusing at first. And when I first started, I had like a little notebook I would write all that information down at. So that way I kind of had like a checklist, so I could just bring in my little piece of paper that showed, like, okay, we have to make sure that they're up to date on their tetanus shot and their pap smear and this, whatever. So I could kind of go through that little checklist mentally, so that way I wouldn't forget it. And sometimes your doctor might be running a little bit behind, but you get busy too. So a lot of times when you won't really see your doctor sometimes, because they'll be in the room with the patient, and then sometimes while they're in a room with the patient, and or when they come out, you're now rooming a different patient for them. So a lot of times you don't see your provider throughout the day. Not saying you might not see them for like a minute or two or whatever, or if you need to pull them from a room, but yeah, that's kind of generally what happens. So that's why you want to make sure you put all of the information as detailed as possible, because you're not necessarily going to see your provider before they go in the room with that patient, because they might be in a room with a patient, now you're rooming a different patient, and now they're going in the room with the patient from the last patient you roomed, but you didn't get a chance to talk to them in between and be like, hey, this patient, sometimes if it was someone I needed to talk to before they went in the room, I would usually put either like a note that had like a code word on it or something on like their little slip, because I don't want to put in there, talk to me before you come in, because then the patient's kind of like, why do they need to come talk to you? What are you going to talk to them about me? Which most of the time, when I had that note, it was usually like I needed to talk to them about a patient completely separate from them, about an issue that I needed to find out sooner rather than later. But yeah, it always kind of looks like to the patient, if you put a note that says, see me before you go in with this patient, they assume that there's something about them that you're going to talk to the doctor about behind their back or something. And So we just kind of put like a code word, and I'm trying to remember what our code word was, but I mean, anyways, you could like put a note on there that just said like, if your code word is gummy bear or something, and they're like, oh, I know I need to go see my medical assistant before I go in the room with this patient or whatever. So whatever you decide with that one, basically. And sometimes you might just be able to put a note on their desk in general that will say, see me before you go in with your next patient or something. But anyways, that's why you want to make sure you put as much detailed information as possible, because they may not see you before they go in that room with said next patient. Does that kind of make sense? Okay, perfect. So a lot of times too, if your provider is running behind, or you know, because you get really busy as well, so you might have your doctor waiting for you to room your next patient, but meanwhile, like you had gone and been doing an EKG in this other room and needed to do an injection in this room, and then you had to, you know, document everything, of course. But let's say you just came out of the room, you know, doing the EKG. Now the patient they were in with is gone, and they just have to go tell the patient these EKG results, but they don't have a patient waiting for them. So sometimes in that case, where basically the provider's waiting for you to bring in a patient, you're going to go over the very basics. So you don't have to go over their whole health history or anything, but you're just going to quickly get their chief complaint, go over their allergies and med list, and then get their vital signs, and then get out of there. We'll just get them, you know, the doctor will do the rest of it, because we want to try to get them, you know, we want them to stay on time as much as possible. And that's something that tends to like run providers behind is, you know, they come out and they're like, hey, I need you to do an EKG in this room and I'll go see my next patient. And while their next patient maybe took like 5 minutes or something. And then they come out and they're like, okay, cool, this person's EKG is normal. We'll just go tell them the results. And then where's my next patient? And you're like, oh, I was busy doing this. So yeah, so you just want to make sure, you know, in that kind of situation, get the bare minimum. You don't have to go over absolutely everything, but of course, allergies and medications, I would say, are always a must, as well as like their vital signs, you know, and what they're here for that day. But some of that other stuff, you know, like the preventative medicine and all of that, you can kind of skip over at that point, because that's going to just take longer to go over. Ideally, you really do want to go over all that information at every visit, but sometimes that's just not possible because, I mean, your doctor might be an hour behind and they're waiting on you to room a patient. And yeah, so you just try to get them in as quickly as possible. And that way we can, you know, get them back on track. So any questions so far? Okay, so this isn't anything on here that I wanted to show you guys, but in between patients, so besides just doing, let me unlock this meeting real quick. Besides, you know, when you're going and documenting in the patient's chart and everything, in between patients, when you come out of the room and you are either documenting the information from that patient you just roomed, because sometimes I try to focus on the patient and not so much on my computer. So I'll just make little notes, like little keywords that tell me, you know, certain things, you know, like abdominal pain, 3 days, you know, no cause or something, you know, try to like write very short things, but like that I know what it'll still mean so I can document it. But anyways, in between patients, when you are not doing that, you will have messages, prescriptions, you'll have the doctor sending you notes to basically, you know, call this patient back about these results, or the doctor sent you a message because the patient called it with a question and this is the doctor's answer to said question, or, you know, you have to call them to remind them that they're due for labs or whatever. You'll have lots of things in between. There's a lot of paperwork that people don't realize is involved as well. And then finding out like what you need to do versus what the doctor needs to do. It gets all sorts of, once you get a system, it works pretty well, but at first, just trust me that when you go in there, you're going to be very overwhelmed. You're not sure how it's going to work. You're kind of like trying to find the perfect balance between the paperwork and rooming the patient, and then also making sure your doctor's satisfied with, your level of care. And so give yourself a break at first, because it is a lot being thrown at you, and trying to find the system that works for you can be difficult. So, and that's something I do want to kind of show you guys too before you go into the field is, different way, the way I do it, and then the way I've seen a few other people kind of balance it. So, because in one day, you will usually have like 12 to 16 patients scheduled, and you want to do chart prep the day before, which is a lot easier if you do that, because then rather than having to ask them on the spot and being in the room with the patient for 15 minutes going over absolutely everything, including when their last colonoscopy was and all that, you can have that already prepared. So you can just have like a little note on their chart that says, hey, by the way, I noticed you're due for your mammogram and colonoscopy and stuff. So instead of having to like look that up in front of the patient and everything. So chart prep is really important because it saves you a lot of time with being in the room with the patient. So that way you have time outside of the room to do all this other stuff, because there's a lot you have to do. Because literally, like with everything, you have to document absolutely everything. Because of course, if it isn't documented, it didn't happen. So you want to make sure, but give yourself some slack at first, because it is a lot being thrown at you, with all the messages and paperwork and everything. So, but yeah, you just want to make sure, you'll find a system that works for you on what works best. Because you'll have messages of patients calling in, you'll have results that are sent to you from the provider that says, call patient and tell them whatever they want you to tell them, or sometimes you'll have recalls too that'll pop up, and you need to mail a letter to the patient to remind them that they're now at that time, to do their 6-month labs. So having to do those. And then filling out paperwork because you get prescription refill requests and having to go through those. And some of those you can go ahead and do depending on your provider. Talk to your provider first. But most providers, they're kind of like anything, as long as it's not a Schedule 2 medication or Schedule 3 medication. Like if it's like a blood pressure medication or cholesterol medication, they're just like, see when the last time they were seen and the last time they had their labs done. And if it was within X amount of time, go ahead and send in a refill. So you're doing those too, but even the ones that you're not necessarily sending in the refill. So like, let's say it is a Schedule 2 medication, like oxycodone. You have to go in, and these ones, you guys are kind of coming in at a time where we're starting to be on the other end of the opioid crisis. However, with that means extra steps you have to do. But just to get that kind of stuff prepared for the doctor, so it shows on there, this is the last time that it was filled, this is the quantity it was filled for, this is the pharmacy it was filled at, this is the, did I already say quantity? I think I said quantity and stuff. These are the directions of the medication. You have to go on a website to find a lot of that information, because that's the most reliable source. So that way we can find out if they're pharmacy hopping, like they're going to Rite Aid and then they're going to Walgreens. So that way the two of them don't know that they've picked up a double prescription, and they think that we can't find out, but we can. So, but going through that information so the doctor kind of knows, like, okay, cool, I have all the information, so I can say, yes, you can go ahead and fill it. Because if you give the doctor this stack of refills and they're kind of like, okay, I have a prescription for Zolpidem. When was the last time they were seen? When was the last time that we filled this for them? Are they due for a refill? Then you're going to be like, what? So, uh-oh, you can't hear me? Okay, good. But yeah, so besides just getting, that documentation for the provider of what brings them in that day, you want to get other information for them on all sorts of things. So prescriptions, the colonoscopies, like I said, those different things. So that way the doctor's like, pretty much our job is to get all of that stuff sorted out so they can come in and they're like, okay, cool. I know that they're due for this, so I'm going to go ahead and order their mammogram. I'm going to tell them that they need to schedule an appointment to come in for a PAP. I'm going to go ahead and fill this prescription because I can see that it was last filled this, point in time. Basically having it to where instead of the doctor having to do any research, we've done all of that for them. So that all of that information before the provider so they don't have to go hunting and then they start running behind and now you're an hour behind and yeah. So, but yeah, that was pretty much it for today. Any questions? All right, perfect. Well, have a good rest of your day, and then have a Merry Christmas. I don't think tomorrow I will not be having any live lessons or anything. So I won't see you until next week. So have a good Christmas.